this is a very prestigious award, but you know, like most awards, it's not just me. I've been trying to build a team where we focus on our long-term care and post-acute. And I think this reflects, you know, how well you can work with the team and empower others. Well, it's extremely important. I can remember, you know, back in 1987 when they had OBRA and you had to have a physician as a medical director. And I was approached by our local hospital. We have a long-term care skilled unit. Would you like to be the medical director? You know, had no training. I was a family physician, but said, oh, sure, that sounds easy. And then after a couple years of that, I heard about AMDA. And I got to go to my first conference in 1994, I think it was in Phoenix. And I can remember sitting there at the lectures and saying to myself, oh my God, this is gonna be tough. There's so much to learn. I don't know if I can do this. But they had the conferences in good cities, so I decided to keep going and eventually learned that, wow, there is a lot that I don't know. And the resources that AMDA had at that point, as far as education, were far superior to any of the other organizations I had been in, and I just engulfed it. And wow, I can't imagine anybody being a medical director and not being a certified medical director. There's just so much more to learn, and PALTmed has that now. You know, they have the curriculum which really shows you what you need to know as a medical director. So it's not just, okay, how do you take care of constipation in the nursing home? How do you take care of, you know, confusion? It's, you know, how does the nursing home work? What's the financial issues? What's the legislation in your state? So it really gives you a lot of these tips on how you can become an effective medical director. And again, that's where it's important. Well, live in Wheeling, West Virginia, and I was a health officer for 22 years, and I got to recognize that homelessness was a public health problem, and we set up a street medicine unit. So we go out to the camps, we have a mobile, and we take care of the health needs. But now I've tried to incorporate that into our nursing homes. We are seeing more people come to the nursing home who are homeless and who have drug addiction who are homeless. So we've been trying to work with our local nursing homes. How do you help somebody like that? Because we're used to taking care of 80-year-olds with dementia. Now you got a 20-year-old person with a drug addiction and is homeless. The key to that is educating the staff. I mean, everybody was kind of afraid at first, but if you kind of empower them and educate them, it can become a good experience. And we've had some great successes with some of our homeless drug addicts, but we find a lot of gaps. And that's where AMDA PALTmed has really helped. I, unfortunately, had been a medical director for 35 years at a facility, and then I got a notice that I was terminated. Whoa. And they hired a person who just worked in an ER, never been a medical director, was going to do 3 facilities. Wow, why are you doing that? Well, I didn't have an answer, but AMDA had help for me. Christian Bergman and Alex Bardock kind of came to my rescue and said, you know, change. We have a committee, the state policy committee. I think you would be good on that, because how do we get things changed? We need to know our legislators. So what we're trying to do in West Virginia is get, you know, a state registry. We're trying to make it where if you are a medical director, you have a CMD, be trained, you know, like California, Mike Wasserman did. You got a 6-year grace period. So again, it's just trying to educate and look where your gaps are and do something. I'm getting older and we're looking for people to replace us. In West Virginia, we have a family medicine residency. They've kind of bought into, hey, anybody interested in this type of medicine, they will come on rounds with me. They'll do a rotation. We had a resident come out last year to San Antonio, and she's here this year, Emily Campbell, in the Futures program. And it's a great title. It's the future of our what we do. We need more people to do this. If they saw the passion that I have for this, I mean, I love going to work. I incorporate my Snoopy obsession into this, and it makes it pleasurable. So, yeah, that's what we need. We need more of our young people to experience it. Unfortunately, some of them don't get to, but once they do, there are going to be some that's what's for them.